this is Dr. Kyle with Ice Clinics, bringing you your next tip for Tuesday. So I wanted to hit on a subject that we see regularly in our clinic today. Most of you know it as whiplash. Whiplash is a mechanism of injury, but there's lots of complications and symptoms that come as a result of that mechanism. So I wanted to dive a little deeper into that and break that down. So one thing to appreciate about whiplash, what most of us know as whiplash, is we understand this motion that our neck does when usually we get in a rear-end car accident. One thing to appreciate is a lot of the research suggests the worst part of the whiplash injury is when our head goes backwards, and this initiating stage when our head starts to get whipped forward. Right here, what we're doing is we're jamming the joints in the back of our neck, and then we're really stretching and often injuring this area of soft tissue in our neck. And so if you can see up here on this chart, one of the things that will affect the most is our upper cervical spine, which incorporates our C2 bone, our C1 bone, and our occiput here. Now this little nub, you can maybe see, it's called the EOP. Your upper trap muscles will go and create a special ligament called your nuchal ligament that goes and inserts here. So that is a very dense and fibrous tissue that gets injured in a whiplash mechanism. But even deeper to that, you have what are called a series of muscles called your suboccipital muscles. And these suboccipital muscles, they've found to have direct muscular attachments to our spinal cord, the outer layer of our spinal cord. So again, when you have a whiplash injury that really stretches this area of the neck, creating instability, you can cause not just ache, pain, headaches, all sorts of issues that are associated with that injury, but because you're getting into the spinal cord, you can cause yourself, as you can see down here in this chart, lots of complicating factors with the nervous system structures in that area of your spine. So again, something to appreciate, because whiplash doesn't just occur with a mechanism where you're getting hit by a car, but for all you snowboarders and skiers out there that are smacking your head against the ground as you fall over, this is a very important thing to appreciate, because it's something that if you jump on it early on and address it the right way, it won't cause the chronic, long-going symptoms as it may if you were to let it go. So one of the reasons that you see me holding this tool is I think this is a really important thing to get in to that area that we were talking about. There's the EOP that you saw up there, and work on some of the scar tissue fibers that develop from a whiplash injury, getting into the nuchal ligament, getting into those deeper suboccipitals, and that can really free up the tension and scar tissue building that's going on in there. And much like I said earlier, can have major complications towards our neurologic system. So when we get in with our Graston tools that we use, one of the things that we do that's unique in our clinic is we challenge your range of motion and position as we're doing this therapy. And the idea is we're trying to feel with these tools where some of the scar tissue fibers have grown, or what we refer to as fascial adhesions. We can come all the way up into the base of the skull. And this can really go a long way as far as reducing some of that tension. And then as far as addressing the underlying joints, the issues with the joints that were caused from the whiplash, checking range of motion, right to left side, front to back, and kind of feeling what these upper cervical vertebrae are doing is much easier to accomplish when we've gotten rid of that scar tissue. So I guess bottom line, for all of you that are watching, if you had some form of a whiplash injury over the course of time, coming to a chiropractor such as ourselves that specialize in some of these soft tissue modalities as well as the upper cervical adjustments can go a long ways as far as restoring your health. And I think if you can appreciate and think back to if you had a severe whiplash injury, you may be able to connect the dots with how that plays into some other health issues that may not necessarily be related to your neck, whether that be stomach, autoimmune, those kind of things. So for all of you watching this, please appreciate the importance of the upper cervical spine. And if you've had a whiplash injury, make sure you are addressing it properly. Again, my name is Dr. Kyle with Ice Clinics. Thanks for watching.